One of the questions that we all ought to be asking ourselves is, how can I prevent a stroke? When I'm lecturing to a large group, I may ask for a show of hands, and if there's a lot of women in the audience, I say, how many of you are concerned that you may get breast cancer? And I would say it's almost uniform that every woman's hand goes up and says they're worried about that. And then if you may ask, are any of you worried about getting heart disease? And if you have heart disease in your family, you would raise your hand. But then you ask the question, well, how many of you are really concerned that you may get a stroke during your lifetime? And it's amazing how few hands go up. And yet it's something that we all should be concerned about, and we all ought to be thinking, how can we prevent a stroke? The American Heart Association has an excellent checklist on their website that you can go to look at how can you prevent a stroke. One of the sayings that we all use is, if it's good for the heart, it's good for the brain. So you're going to think, well, this checklist isn't that much different than if I'm trying to prevent heart disease. And that's right. So the first thing you want to do is manage your blood pressure. And it always surprises me how many younger people have no idea what their blood pressure is. There's a reason that the drugstore and the grocery store and all these places have blood pressure machines so that you can sit quietly, relax, take a break, and then check your blood pressure and know what it is. And you need to manage it. We have new criteria, and this is not the place to go through that, but we're much stricter about managing blood pressure than we used to be. Know what your cholesterol is, and know what it is at a young age. When you're 70 is not the time to just start thinking about, do I need to manage my cholesterol? If you have diabetes and your blood sugar is high, tight control is important. We didn't used to think so a long time ago, and now we know that tight control of blood pressure is very important. Activity, exercise, even if it's walking. Walking is a really important exercise and shown to be highly effective in prevention of heart disease and stroke and controlling your blood pressure. Diet, there's a lot of diets out there, and a lot of diets have been looked at. And it basically gets down to, is it a healthy diet, and lose weight if you're overweight. And the most important thing is, if you smoke, stop, because smoking will kill you and really accelerates all of the things we just talked about. So go back, look at that checklist. It's readily available on the American Heart Association website, and see where are you right now, and try and make sure you have a healthy life and don't have a heart attack or stroke.